Picture this. Weeks before anything dramatic happens, before any chest pain, before any emergency room visit, before any ambulance ride, a person simply starts feeling tired. Not the normal kind of tired that goes away after a good night's sleep, but a heavy, unusual exhaustion that seems to come out of nowhere and just won't lift, no matter how much rest they get. Most people brush it off completely. They blame stress, they blame getting older, they blame a busy schedule, and they carry on with their day. But what if that exact feeling, the one almost everyone dismisses without a second thought, is actually the body's earliest and clearest warning sign that something serious is building up inside the heart? Stay with me until the very end of this video, because understanding this one overlooked symptom could genuinely be the difference between catching a problem early and facing a life-threatening emergency later. For years, most people have been taught to associate a heart attack with one single image: sudden, crushing chest pain, someone clutching their chest and collapsing without warning. And yes, that dramatic moment does happen. But what doesn't get nearly enough attention is everything that often happens in the weeks leading up to that moment. Cardiologists and researchers who have spent years studying heart attack survivors have found something remarkably consistent. A large number of people, when asked to describe how they felt in the days and weeks before their heart attack, don't talk about chest pain at all. Instead, they describe something much quieter, much easier to dismiss, and far more common than most people realize: an overwhelming, unusual sense of fatigue that showed up well before anything else. This is exactly why so many doctors and researchers now consider unexplained, unusual fatigue to be one of the most significant early warning signs the body can give before a heart attack. And what makes this particular symptom so dangerous isn't that it's rare or hard to notice, it's actually the opposite. It's incredibly common, incredibly easy to explain away, and incredibly easy to attribute to almost anything else in daily life. That combination, a genuinely important warning sign hiding inside something that feels completely ordinary, is exactly what allows it to slip past so many people until it's too late. Let's talk about why this happens physiologically, because understanding the reason behind it makes it much easier to take seriously. In the weeks leading up to a heart attack, the arteries supplying blood to the heart can become increasingly narrowed or partially restricted, often due to a gradual buildup of plaque inside the artery walls. As this narrowing progresses, even before it becomes severe enough to cause a full blockage, the heart may already be working harder than it should, receiving slightly less oxygen-rich blood than it needs to function at its best. The heart, in response, doesn't always announce the struggle with obvious pain. Instead, one of the earliest signs of a heart working under strain can simply be systemic fatigue, a feeling of exhaustion that isn't tied to physical exertion, doesn't improve with rest, and often feels noticeably different from typical tiredness. What makes this fatigue so distinct, according to people who have experienced it before a heart attack, is a particular quality that separates it from everyday tiredness. It's often described as a deep, heavy exhaustion, sometimes appearing suddenly rather than building gradually, and sometimes accompanied by a strange feeling of general weakness, almost as if the body's normal energy simply isn't there anymore. Some people describe feeling wiped out after doing tasks that never used to bother them, like walking up a short flight of stairs, carrying in groceries, or even just getting dressed in the morning. Others describe a persistent, draining fatigue that lingers through the entire day, regardless of how much sleep they got the night before. This particular pattern has actually been studied specifically in relation to heart attacks, especially among women, where unusual fatigue has repeatedly stood out in research as one of the most commonly reported symptoms in the days and weeks leading up to a cardiac event, often appearing well before any chest discomfort ever shows up. This is a critical detail, because heart attack symptoms in women have historically been underrecognized, partly because the popular image of a heart attack has been based heavily on how symptoms tend to present in men. For many women specifically, unusual fatigue, along with a cluster of other subtle symptoms we'll talk about shortly, has turned out to be a far more common early warning sign than the classic, dramatic chest pain most people expect. Now, It's important to say clearly that fatigue rarely shows up completely alone. In many cases, people who later experienced a heart attack recall a combination of subtle symptoms appearing together in the weeks beforehand, even if each one individually seemed minor or explainable on its own. Alongside unusual fatigue, some of the other commonly reported early signs include disturbed or unusually restless sleep, a sense of shortness of breath during activities that previously felt completely normal, mild but persistent discomfort or pressure in the chest, upper back, jaw, or shoulders that comes and goes rather than staying constant, unexplained indigestion or nausea that doesn't seem connected to anything eaten, and a vague, hard-to-describe feeling of anxiety or unease, almost a sense that something isn't quite right, even without being able to pinpoint exactly what. Individually, every single one of these symptoms has a dozen harmless explanations. Fatigue could be from poor sleep or a stressful week at work. Shortness of breath could be blamed on being a little out of shape. Indigestion could be blamed on a heavy meal. Anxiety could be blamed on any number of everyday stressors. And this is exactly the trap, because each explanation sounds perfectly reasonable on its own. It becomes incredibly easy to dismiss all of them individually without ever stepping back to notice that several of them are actually showing up together, repeatedly over the same stretch of weeks. This is precisely why doctors increasingly encourage people, especially those with known risk factors for heart disease, to pay attention not just to any single symptom in isolation, but to patterns. A single tired afternoon means very little. But unusual, unexplained fatigue that persists for days or weeks, especially when it shows up alongside even one or two of these other subtle symptoms, is a pattern worth taking seriously and worth mentioning to a doctor, rather than waiting to see if it eventually resolves on its own. Now let's talk about who should be paying the closest attention to this particular pattern. People with existing risk factors for heart disease, such as high blood pressure, high cholesterol, diabetes, a family history of heart disease, a history of smoking, or being significantly overweight, are generally considered to be at higher overall risk, and for these individuals, unusual fatigue combined with any other subtle symptom deserves prompt medical attention rather than a wait-and-see approach. But it's also worth remembering that heart disease doesn't exclusively affect people who fit the obvious risk profile. Plenty of people who go on to experience a heart attack didn't consider themselves to be at particularly high risk beforehand, which is exactly why this kind of awareness matters for a much wider audience than just those with an obvious risk factor checklist. It's also worth addressing something that often gets in the way of people actually acting on these symptoms, and that's a very human, very understandable reluctance to make a big deal out of what feels like a minor complaint. Many people, especially those who are used to pushing through tiredness or who don't want to seem like they're overreacting, simply keep going about their normal routine, telling themselves they'll rest more this weekend, or that things will improve once a busy stretch at work settles down. This instinct to minimize and push through is completely human, but in the context of unusual, unexplained fatigue combined with other warning signs, it's exactly the instinct that can cost precious time. So what should someone actually do with this information? The first and most important step is simply learning to recognize the difference between ordinary tiredness and something that feels genuinely unusual, more sudden, more persistent, or noticeably different from normal fatigue. The second step is paying attention to whether this fatigue is showing up alongside any of the other subtle symptoms mentioned earlier, even mild ones. The third and most critical step is not waiting to see if it simply goes away on its own, particularly for anyone with known risk factors for heart disease. Reaching out to a doctor to describe exactly what's being experienced, rather than deciding in advance that it's probably nothing, gives medical professionals the opportunity to properly evaluate what's going on, whether that means running tests, checking heart function, or simply ruling out other causes. It's also worth mentioning that raising this concern with a doctor doesn't need to feel dramatic or urgent in tone to be effective. Simply saying something like, "I've been feeling unusually exhausted for the past couple of weeks, and it doesn't feel like my normal tiredness, and I've also noticed some shortness of breath doing things that usually don't bother me," gives a doctor exactly the kind of specific, pattern-based information needed to take the concern seriously and investigate appropriately. This single conversation, one that takes just a few minutes to have, can open the door to catching a developing heart problem early, potentially long before it ever escalates into an actual emergency. This is also an important topic to share within families, particularly if there's a parent, spouse, or older relative who tends to downplay how they're feeling or who might not think to connect the dots between several seemingly unrelated symptoms. Sometimes it takes someone else noticing the pattern from the outside, a family member who says, "You've mentioned feeling exhausted a few times this week, and you also said your chest felt a little off yesterday, maybe it's worth getting checked," to prompt someone into actually seeking medical attention instead of quietly pushing through it alone. There's another important angle to this worth exploring, and it has to do with how this fatigue tends to interact with a person's usual routine in ways that are easy to overlook unless you're specifically watching for it. Many people who later recall their pre-heart attack fatigue describe a very specific shift, not simply feeling tired, but feeling like their normal energy reserve had suddenly shrunk. Tasks that used to feel automatic, folding laundry, walking the dog, tidying up the kitchen after dinner, suddenly required a level of effort and willpower that felt completely out of proportion to the task itself. This isn't the kind of tiredness that responds to an extra cup of coffee or an early night's sleep. It's a deeper kind of fatigue, one that seems to sit in the muscles and the mind at the same time, and one that doesn't meaningfully improve no matter how much rest is given to it. It's also worth understanding why this particular symptom tends to get so easily buried underneath the busyness of everyday life. Most people leading up to any kind of health event aren't sitting quietly, monitoring their body for warning signs. They're juggling work, family responsibilities, errands, and 100 other small demands on their attention. In that kind of environment, a growing sense of fatigue can very easily blend into the general background noise of a busy, tiring life, especially if that person already considers themselves someone who's always a little tired anyway. This is exactly why it helps to occasionally pause and ask a slightly different question, not simply, "Am I tired?" which almost everyone would answer yes to on any given day, but rather, "Does this feel different from my normal tired, and has it been sticking around longer than it usually would?" It's also worth noting how doctors themselves approach this kind of symptom when a patient brings it up. Rather than jumping straight to alarming conclusions, a doctor evaluating unusual fatigue combined with other subtle symptoms will typically look at the full picture, checking blood pressure, listening to the heart, potentially ordering blood tests or an electrocardiogram, and asking detailed questions about exactly when the fatigue started, how it feels, and what else has been happening alongside it. This kind of evaluation is often quick, straightforward, and far less intimidating than people expect, yet it can provide enormously valuable information, either offering reassurance that everything looks fine, or catching an early warning sign before it develops into something far more serious. Either outcome is a win, because both provide clarity instead of leaving someone to quietly wonder and worry on their own. This is also a good moment to mention that seeking medical attention early for symptoms like these is never something to feel embarrassed or hesitant about, even if it turns out to be nothing serious. Doctors would overwhelmingly rather evaluate 10 cases of unusual fatigue that turn out to be harmless than miss the one case where it was an early warning sign of something significant. The relief of hearing "everything looks fine" is always worth far more than the discomfort of asking the question in the first place, and no doctor is ever going to view that kind of proactive concern as an overreaction. One last thing worth mentioning is how this awareness can quietly become part of a family's everyday habits, without ever needing to feel heavy or anxiety-inducing. Simply knowing what to watch for, and gently checking in with loved ones when something seems a little off, can be one of the most protective things a family does together, far more valuable than waiting for a crisis to force everyone to pay attention all at once. To bring everything together, the idea that a heart attack always announces itself suddenly and dramatically, without any warning beforehand, simply isn't the full picture. For many people, the body offers a quieter, earlier signal first, often in the form of unusual, persistent fatigue, sometimes accompanied by shortness of breath, mild chest discomfort, unexplained indigestion, disturbed sleep, or a vague sense that something isn't right. None of these symptoms, taken individually, guarantee that a heart attack is coming. But recognizing this pattern, taking it seriously rather than dismissing it, and reaching out to a doctor when it appears, gives people a genuine opportunity to catch a developing problem early, while there's still time to act. All the information shared in this video is intended purely for general health awareness and is not a substitute for professional medical evaluation. If you or someone you know is experiencing unusual, persistent fatigue along with any other concerning symptoms, it's always best to consult a qualified doctor promptly rather than waiting to see if it resolves on its own. If this video helped you understand something important today, make sure to subscribe to the channel so you never miss information that could help protect the health of you and the people you love.